and self-care. Um, as we are going through life and our busy schedules, that you remember to also take care of you. And so that's what I would like to say to you, to keep being inspired, keep being empowered to move your wonderful communities, to keep being amazing women and leaders in the communities that you serve. So thank you. Madam Clerk?
Let the record reflect that Member Wilson has joined the meeting.
Thank you.
Moving to item D, unfinished business, there is none listed. Moving down to E, Wayne County Commission update by Member Melissa Dobb.
Hello, everyone. I just have one quick thing. Stephanie Jackson, who runs the Safe Sleep program with our Wayne County Health Department, has invited us to collaborate with her on an event that she's holding. It's sort of a Galentine's Day baby shower event on excuse me, next week, Friday, February 21st, in Taylor. And she is going to be talking to pregnant people and new mothers about how to put their infants to sleep safely, to reduce the risk of SIDS and infant mortality rates. And our contribution to the event would be to take the training that we're going to be learning today about Narcan and talk to the women there about the Wellween stations, and provide them with, the informational flyers, and talk to them woman to woman about why it's important to have Narcan in their first aid kits, especially women who are going through pregnancy. Maybe they're experiencing pain, and why it's really important to have this Narcan in their homes, just in case something might happen. So I'm going to put the link to the event in the chat, and then I'll also email it out to everyone. If you can make it, please let me know so that we have a count of who from the Women's Commission will be able to attend. And also, if you can promote it on your social media pages, or anyone else that you might know would have an interest in attending, please, get the word out. So that's all I have for now. Thank you.
All right. Awesome job, Commissioner Dobb. Thank you for your work as well. Madam Clerk?
Moving to F, new business, item 1, Black History Month update by Vice Chair Cynthia Douglas.
Good afternoon, everyone. I'm just going to make this real quick. We have a full agenda. So I was just going to mention it is Black History Month, February, the month of February. And just to give you a little background, Black History Month was founded by Carter G. Woodson. He was a scholar who dedicated to celebrating the historic contributions of Black people. It began in 1926 as Negro Week. February was chosen because it coincides with the birthdays of President Abraham Lincoln, which is February 12th, happy belated birthday, and Frederick Douglass, whose birthday is February 14th, Valentine's Day. These were two important figures in the abolitionist movement. Black History Month is celebrated nationally every February since 1976. The Lift Every Voice and Sing, which is often referred to as the Black National Anthem, was written as a poem by NAACP leader James Weldon Johnson in 1900. His brother, John Johnson, composed the music for the lyrics. A choir of 500 school children at the segregated Stanton School, where James Weldon Johnson was principal, first performed the song in public in Jacksonville, Florida, to celebrate President Abraham Lincoln's birthday. At the turn of the century, 20th century, Johnson's lyrics captured the hopeful appeal for the liberty of Black Americans, set against the religious invocation of God and the Promise of Freedom. The song was later adapted by NAACP and used as a rally cry during several civil rights movements of the 1950s and 60s. It is now used at several prominent African American events across the country. I just encourage each of you, although we celebrate Black history, we also need to educate ourselves about Black history and the contributions of Black Americans to this country. There are several places that you can go. Second Baptist Church, which is located in Greektown, that was the Underground Railroad site, as well as I think it's Central Methodist Church, which is on Woodward. They have a reenactment of the Underground Railroad, where they take you through a series of paths that might have been taken by. It's just a reenactment, so they have actors, and then it's set up like a Underground Railroad. Also, Birmingham was an Underground Railroad site as well years ago, and they have a museum that has a permanent display of the Underground Railroad exhibit. And if you like to read Source Books, which is located in the New Center area, they have a large selection of books written by and about African Americans. So I just implore you to just take some time, not only to celebrate, also to educate yourselves on African American history. And that's all I have. And I really appreciate you all taking the time to listen to me. And thank you, Madam Chair, for that time.
All right, Vice Chair Douglas, thank you so much for that wonderful, wonderful Black History report. Thank you. Great job. Madam Clerk?
Item 2, 2025 Resource Fair Update by Member Gator.
Good morning, Chair. Just have a very brief update where we are planning committee.
I'm sorry, Member Gator. Member Gator, we're having a difficult time hearing you. I don't know if your video, I don't know if you can go off video and then just do audio for a moment. Because you're sounding very.
Is that better now?
Not yet, not yet. We want to hear your report. If you,
Yep. I am in a hospital, so I'm hoping this is better now.
Yes, it's perfect. Okay,
All right.
Member Gator, please proceed.
Thank you. Again, good morning, everyone. I'm Latanya Gator. For those who are new to the call, thanks to this body and Chair Crawford, I've been tasked with the duty of leading the event planning for our 2025 Women's Resource Fair. Just a friendly reminder, it is scheduled for Monday, April the 7th, to be held at Schoolcraft College, Vista Tech Center. And I just have a very brief report just to let everyone know where we are with the planning. So we continue to meet on a biweekly basis. Some of our invitations have went out to the companies we would like to invite. And I ask that all of you, if you would like to see a company there to support us in health and wellness, recreation, skilled trades, education, and employment, to please send those recommendations to us via email so we can make sure that we pack the house with the exact number of companies that we need to make sure all of the services are highlighted and that we're truly supporting the women of Wayne County in all of those areas. We are finalizing the flyer to be sent and distributed publicly so we can start to invite our attendees. And thank you again, Cynthia, for working with us to make sure that that gets done. We have some new and exciting things that we're putting together, again, just to make sure that our attendees can get to and from the fair, addressing all barriers to transportation. And we're also looking to make different partnerships with other schools to make sure, again, that all services and needs are met. And that concludes my report. I'll lean on the committee members to add in anything that I may have forgotten. And I'll continue to give updates on the report as we meet as a body. Thank you.
Member Gator, this is Chair Crawford. Would you like to speak about any volunteers at this moment or requests?
Not at this time. And again, I'll lean on you if you feel it's a good idea. But we're still creating the Eventbrite and all that we need to be able to roll out. And then I was thinking at that time we'll recruit volunteers. And I know Melissa, member Schultz had some ideas around that too. So I just wanted to give her some respect before we move forward with that.
Awesome. Thank you so much for your leadership and hard work. And we will continue to go through your leadership for this amazing resource fair. We'd love to recognize, I don't know who was first between Vice Chair Douglas and Member Collins, but let's go with Member Collins and then we'll go with Vice Chair Douglas.
Thank you. Hello, everyone. I just wanted to say that we are in the process of creating the flyer or making revisions to the flyer. Once it goes out to the commission, we would love for you to spread the word as well as share that information on your social media platforms and anywhere else you deem appropriate. Thank you.
Vice Chair Douglas. Thank you, Member Collins.
Yes, thank you, Member Collins and Member Gator, especially Member Gator for her leadership on this, and also Member Schultz for spearheading the and coordinating between Schoolcraft College. We also have decided on a new logo as well for the Women's Commission. Can I share my screen?
You should be able to share. Let me unshare.
Okay. And here is the logo. Can everybody see that?
Yes, I can see it, Cynthia. Yes.
Okay. So this is going to be our logo for the shirts for the Women's Commission, for our shirts and a tablecloth. Okay. So this is the new one.
And tote bags, Cynthia. And tote bags.
Yeah, no, tote bags. Sorry. Tote bags, shirts, and tablecloth. So, yeah. Okay. And that's it. That's all I have. Thank you. So I'm gonna stop.
All right. Awesome, Vice Chair Douglas. If you check out Vice Chair Douglas, she's gonna make sure that the Wayne County Women's Commission is swagged out. She will make sure that we are looking good and looking amazing. And I thank you again to all of you amazing women for this. The only ask that I have from our wonderful women of the Wayne County Women's Commission is to April 7th is on a Monday. And if you have availability and you can help us out, because it'll be like one of those all hands on deck. No matter if it's 2 hours, 4 hours, the entire day, because again, this is our event. Please send a message to Member Gator, who's also chairing the Wayne County Women's Commission Resource Fair. You can also reach out to Vice Chair Douglas and I. We will also get that information over to Gator so that she can continue to spearhead such an amazing event. But again, Monday, April 7th, volunteers, we, with our wonderful body, we need you because we are representing Wayne County as one. So thank you so much. Madam Clerk.
Item 3, Heart Health Month, American Heart Association by Elaine Bowles-Dukes.
Okay. I have an introduction from Ms. Dukes, if I can, Madam Chair.
Yes, and of course, thank you.
Elaine Bowles-Dukes is the Fired Up Community Advocacy Director focused on the Greater Detroit area for the American Heart Association and the Collaboration for Equitable Health. Ms. Bowles-Dukes has been with AHA for 2 years. Elaine is an alumni of University of Michigan, holding degrees in political science, women's studies, and African American studies. Her master's work was completed at Metropolitan State University in Management Administration. Her current academic pursuits include enrollment at Walden University in the Public Administration program with a goal of obtaining a doctorate degree. She is, I gotta scroll down. She is a dedicated community servant. Prior to acting in her current role, she served 3 terms as president of the Lansing City Council, sat on the GSHOM Board of Trustees, Michigan Works Board, served as MCEA Public Relations Task Force Chairperson, was a ASPRA Award nominated PR professional, and Executive Director of several senior living communities. She is certified as a diversity trainer and dementia practitioner. As a proud member of Delta Sigma Theta sorority, Inc., she is also pledged to social action and community engagement. And I present to you Aylin.
Thank you, Vice Chair Douglas, and thank you certainly to the Chair Crawford, for honoring the invitation that was extended by your Vice Chair to me to come today. I wanted to stop her midway from reading all that. I was like, no, you pick out just a couple things. We don't need to read all of that. What it basically says is I'm here in heart with you all as you do your work for women in Wayne County. My undergrad, one of them is in women's studies, and I have always worked towards the betterment of women. My dad said I came home from the University of Michigan with an I am woman, hear me roar, and Ungawa Black Power. So I think I carry that on to this day. Today, I get the wonderful opportunity to share with you about Heart Month, which February is for American Heart Association. And I presented recently to the commission, and the goal was to share a little more laser-focused information. So I'll give you the broad information about heart health, and then we'll drill down a bit. I've got about 10 minutes, so I've spent one to go over numbers and some data, and it's just some helpful information, I hope, today for women's heart health. So each year, more than 350 people, including 23 or so thousand children in the U.S., experience cardiac arrest outside of the hospital. And when that happens, CPR can double or even triple a person's chance of survival. But most times that survival rate is at 9 out of 10 not surviving. So only 1 survive an out of hospital cardiac arrest episode. And that is frightening. And in America, our challenge is to try and make the nation a nation of lifesavers. And that's our movement. And we ask that folks through that movement learn CPR. Most households, neighbors, family members have no one within their sphere who is actually trained in hands-only CPR, because we are encouraging that even if you just keep the heart moving during a cardiac arrest, you can save a life, and let alone within being certified in CPR. So what we ask is that both schools and communities, churches, faith-based organizations actually prepare a cardiac emergency response plan. And that is to prepare where your AED is, your automated external defibrillators, that's a mouthful, but AEDs, and that someone's trained in it, someone knows the address of where you're at, the location of where the episode has happened. And this can make the difference between life and death. AHA is in our goal and quest committed between now and 2030 in doubling, increasing the number of people who know how to perform CPR. And that's what we're working towards. All of our public policies and in advocacy, that's what I work, is to move the needle forward on public policy. So cardiac emergency response plans are vital. Telecommunicator CPR is vital. You don't know that Most folks don't know that many times when you call 911, that operator then patches you into someone else, and you have a very small window of time to actually begin your CPR to make a difference in someone's life. So it is imperative that not just dispatchers in the state of Michigan, but also operators and anyone who answers that 911 line knows how to walk someone through verbally CPR. And we are working on that and infusing that into the standards of training in the state of Michigan and specifically Wayne County. We also have a requirement at the school level, and that is for all students to be trained in CPR, exposed to it, educated in it. And at this point, that is on the books as far as our laws go. But the funding for that, as well as the ability to train and track that data on who is getting trained, has not been implemented or put in place. And so we're working to make sure that happens as well. Now, that's our general information for just heart and heart health. Now, as far as women goes, I need you all to know that the number one killer of women, not just in our area, but in all areas, which causes 1 in 3 deaths every single year, and a third of mothers, sisters, friends, neighbors, coworkers, is cardiac disease. Now, how to manage cardiac disease, how to deal with it, and how that affects women, there are 10 facts that we should all know about cardiac disease. I'm only going to cover a couple of them. I want to make sure that everyone knows that it kills more women than all forms of cancer, and yet only 44% of women recognize that cardiovascular disease is their greatest health threat. Most times folks would say breast cancer, ovarian cancer, maybe lung disease, kidney disease, but the number one killer for women, unfortunately, is cardiovascular disease. Also, among females 20 years and older, nearly 45% are living with some form of cardiovascular disease, and less than 50% of women entering pregnancy in the United States have a good heart health. And how do we know that? In most cases, folks haven't gone to their doctors. Women are most likely to skip their annual appointments and checkups, and in lieu of many times taking a loved one, a child, a parent to the hospital or doctor appointments, and ignoring themselves. So over 1/3 of maternal deaths actually happened because there was some presence of cardiovascular disease. And then overall, 10 to 20% of women will have a health issue during pregnancy. It can be high blood pressure, preeclampsia, diabetes, gestational diabetes, hard to say when you put it all together, also affect during pregnancy. So those are some of the things. One of the last is 51.9% of high blood pressure deaths, otherwise known as hypertension, or the silent killer, are in women. So you couple hypertension with high blood pressure, hypertension, diabetes, all coupled with cardiovascular disease. Women, as your chair Crawford said, we have to take care of ourselves. And unfortunately, we have found a place that society actually wraps their arm around, which is us as caretakers of everyone else. But if we don't, and we know this on any airplane, if you don't put your oxygen mask on yourself first, you can't help anyone else. So if you don't take care of your own heart health and your own possibilities of cardiovascular disease, high blood pressure, hypertension, diabetes, we know that we can't help anyone else. And that flies in the face of what we're taught as good, strong women, and that is to care for everyone in our community, our household, our community, our churches, and every room that we're in. But if I can implore you, sisters, to do anything today, is one, go for your checkups, go for your appointments, check your heart. And then also, if you have access to a self-monitoring blood pressure machine, that you use that regularly and you track your numbers. as well as for your heart health, that you actually are following the instructions of your doctor after you attend those annual meetings and appointments, and that you are sharing this information with other women who are in your circle, in your community, and in your family. And if we all do that after we've taken care of ourselves, then we can all, each one reach one, each one teach one, and be able to make sure that we all are living longer and healthier lives. Thank you. I think I stayed within my time too, Senator Douglas. So I won't be barred from coming back to you again.
Thank you for that. And we really appreciate you coming and sharing that information. We have a few minutes for some questions because we do have a full agenda. Did anybody have any questions? Okay. Seeing none, again, thank you, Aileen. We really appreciate you. And Madam Chair, thank you for that time.
Ms. Dukes, you hit it out the park. She did a phenomenal job. Thank you so, so much again. And yes, you know, you can come back and visit us anytime. Thank you again. All right. Madam Clerk, if we can move forward, please.
Item 4, Narcan training by member Melissa Dobb.
Okay.
I'm back. So, very happy to bring this forward to the Women's Commission. I know we've talked a little bit about it before, but one of the initiatives from Wayne County is we used some of our opioid settlement money to put out we call them Wayne stations, and they're vending machines that people can go and get free Narcan and fentanyl testing strips, and they are all throughout the county. I am going to turn this over to the experts. I know I saw Tara King and Dr. Avani Cheth online. I'm not sure if they brought anyone else, but I'm going to turn it over to them for the presentation. Take it away.
Thank you so much, Commissioner Dobb. We are so excited to be here. You know, I believe that, I don't know if, Tara, you're sharing, we had to rearrange some of the slides that we sent earlier to be in order. So,
yes, if possible.
If it's possible.
If possible to do a quick screen share, wonderful. And thank you so much, Chair Crawford and Commissioner Dobb and all of the membership for having us today. All right.
There we go. So we're so excited to have this opportunity to share more about initiative Wayne Station that Commissioner Dobb introduced, and then just increase awareness and share knowledge about how everyone can carry naloxone, which is a life-saving medication to reverse overdoses, feel comfortable and empowered to do this and really spread the message around this life-saving intervention and just about overdose and the extent of the problem in Wayne County. Avani Cheth, Chief Medical Officer at Wayne County Health, Human and Veteran Services Department. And I'm joined here with Tara King, who is our Community Behavioral Health Administrator and who leads a lot of our initiatives in this space, including the Wayne Stations. So we're just going to get started with just framing, providing some background and context about why we're doing what we're doing, right? And I don't think I need to this is not new knowledge for anyone here that overdose crisis is a significant public health challenge in Wayne County, continues to be in Michigan and Wayne County, across the country. Too many lives continue to be lost. And whenever we have these presentations, I know that in the audience, it's likely that everyone has been touched by this in some way, shape, or form. Wayne County disproportionately is impacted in Michigan. We account for nearly 1,000 drug overdose deaths in 2023. That's about a third of the deaths, and we make up about 18% of the population. So we do have a disproportionate amount. And we know that one of the main primary drivers is fentanyl, right? This powerful synthetic opioid that has been in the drug supply for several years. And that is what's really driving and behind about 4 out of 5 of our deaths. We do know that, though, over time, the drug supply has changed. So now we have the majority of our deaths involve more than one drug, right? 3 in 5 deaths involve more than one drug. And half of those involve cocaine in Wayne County. So I'm sharing local data here. And so what we're seeing is a drug supply that has become more and more dangerous and unsafe over time. We are also seeing a drug supply that is varied in terms of what is actually in the drugs, right? And so we're seeing fentanyl being widely in the drug supply in lots of different types of drugs, including drugs that aren't necessarily traditionally what we think about as opioids, like heroin and other opioids. And we're finding it in things like all sorts of fake counterfeit pills that are out there, including cocaine. We know that in Wayne County, there is a significant health equity issue around this, with Black residents experiencing nearly a little bit more, actually, than 2 times the rate as our white residents. And so we have the 2 graphs on the side. Can you go back for a second, Tara? Okay, so the one in the center, just to kind of this is the Substance Use Vulnerability Index. It's a measure that the state uses to identify counties and regions that are more vulnerable for harms related to substance use, and we're ranked number 1. And then the right graph just underlines the disproportionate impact in Wayne County. We have nearly almost a 2 times the rate of overdose death rates than the state of Michigan. And our population, you can see, and this is also important to kind of, we have these kind of like concepts of who is dying, right? And looking at our local data is really illuminating in this. And so you see the right, like kind of lighter green graphs are our Wayne County rates of overdose. You don't have to look at the numbers. I know they're small, but I just want to lift up a couple age groups. So you see the 55 to 64. So this is our older population, right? Has a significantly higher rate of overdose death rates in Michigan. And then we have our Black population at the bottom with also a higher rate. And then this is not local data. This is actually national data of the trend line of who's dying from drug overdoses over time. This goes all the way back to, I think, the 1990s or 2000s, right? And just to make clear that this overdose epidemic has changed over time, and we've had different waves based on the different drugs that have been out in the drug supply, right? So the first wave, the green wave, was really marked. That was way earlier, more than 20 years ago, when we had a rise in opioids being prescribed, right? And we have heard a lot about that, right, in the medical community. The second wave, the purple wave, is the increase in heroin overdose deaths. And then the blue box, which is around 2013, it should be 2012, 2013. That's when we saw overdose deaths really spiked, because fentanyl really started entering the drug supply in a much more broader way. And that was really driving a lot of the deaths. And then where we are right now is the red box. And this is playing out across the country and in Wayne County as well, where we're seeing fentanyl with what we're saying is stimulants. And stimulants are a broad family of drugs, but the main one in Wayne County is cocaine. Included in that is also methamphetamine and other amphetamine products. But we're seeing fentanyl, which is a strong opioid, getting mixed into this other drug supply that is also driving a lot of our local deaths. And this is just to underline some of the things that we already mentioned about, this is all of our drug overdose in Wayne County since 2016. So our more recent data. The different colored lines are the different drugs that are being found in overdose deaths when we send these to the lab to study what is responsible for the overdose. And so we have, the dotted hash line is all of our drug overdose deaths over time, and you can see the main message there is that there continues to be an increase in Wayne County up until 2023, though it's slowed a bit. There continues to be an increase in overdose deaths. And then the lines after it are the most common drugs that are being found. And so we have that tan brown line right underneath making up so synthetic opioids are really fentanyl, right? So that's over 80% of deaths involve fentanyl. Then we have the green line underneath that is polydrug. So more than half of our deaths involve more than one drug. And then we have that kind of salmon color right underneath with cocaine, really increasing in the last couple of years, being found in our deaths. Nearly half of the deaths in Wayne County involve that. Okay, I'm going to hand it off to Tara, who's going to talk a little bit more about the Well Wayne Station Initiative and some of the progress we've made since we've launched this initiative.
Thank you, Dr. Sheff. Thank you, everyone, for having us today. I am mindful of time, so I'm going to talk quick, but I think the biggest things that I would say following this bit, at least around Well Wayne Stations, is please do not hesitate to reach out for questions or follow up. We'll make sure that there's some resources provided to this group beyond those that were already provided. And just a piece as well, our website, which is End Overdose Wayne, is live. There's resources including station locations. We have multilingual and translation services for some of the information that's on there. So I just want to put it forth as a reminder that there are broader public resources available attached to this. Really quick, Well Wayne Stations, Commissioner Dobb had previously discussed it, but really it's our response strategy not only to the local overdose crisis, but really in an aim to try and provide low barrier, free access to naloxone and drug testing supplies, and to position vending machines and newsstand style devices throughout all communities in Wayne County, especially those that are disproportionately impacted, as a means towards doing that distribution, whether it's for naloxone, drug testing supplies, or in the future, potentially other health supplies to kind of change out the contents of those machines. A quick rundown of what it is. It is a countywide initiative, multi-year. Commissioner Dobb had also alluded to the funding source, so it's braided funding, both with opioid settlement funds and post-ARPA dollars. And our main project partners on this are Wayne State University Center for Behavioral Health and Justice. And so we're working collaboratively to really support access, placing stations, vending machines, and newsstands throughout the entire Wayne County region. Just a quick rundown of what is included currently in those stations. We have naloxone, fentanyl testing strips, and xylazine testing strips. As far as current placements and sites, we have 38 stations live and active, 19 vending machines, 19 newsstands. This is just a quick screenshot of the Google map in which all of the station locations are included. That's on our website. And then there's full information for what's included in those devices, where they're located, the host sites that they're located at, their website, all of that's on the map. Those that are in red are 24/7 access, and those that are purple are non-24/7, but we're trying to increase the 24/7 access. In terms of coverage, like I said, we have 19 of the 43 municipalities covered, and we're in process of placing in 4 additional municipalities. I think one of the other big pieces too, knowing the geographic disproportionate impact, is we have roughly half of our high priority communities. So that's high SUVI, substance use vulnerability index, and high overdose communities with current access points. As far as deployment of supplies, we haven't really done formal or robust communications yet. That will be coming. And so I think part of this is raising awareness among this group and others around where to direct individuals, whether it's to the website or broader awareness about this initiative, because we'll be having communications going out countywide, likely in the next month or so. As far as what's been taken from these machines, what's been deployed, since September, there's been a little bit over 3,700 naloxone kits taken, over 1,200 boxes of fentanyl testing strips, and 772 xylazine testing strips. And I think it's important to note as well, just in January alone, so we have 38 current stations. Placement started in late August. It was literally like August 31st. From September on, we've incrementally increased where those stations are, the number of stations we have available. And just in January, you can see the breakdown of supplies taken. We have almost 40% of total supplies deployed, 1,400 kits in January. Same thing goes with fentanyl testing strips and xylazine testing strips. And I'm going to toss it over to Dr. Sheth, but just with a final piece regarding the Wellwayne Stations Initiative. Again, we'll pass forward resources and happy to meet with any of the individuals on this call to unpack further and make sure that we're providing updates as far as communications and further program development.
Thanks so much, Tara. And so we're going to go into a little bit more. So those stations, they carry the Narcan, right? And so we want to go into a little bit more on naloxone and go over kind of how to use naloxone, how to respond to an overdose. And, I like to not use the word training because I feel like then it becomes like something that people feel like they need to have some sort of formal training to actually feel comfortable to do it. And what we're really trying to spread the message is that this is something everyone should feel empowered and educated and learn how to do, and get these life-saving kits out to the people in the community around the overdoses where they're happening, and hopefully have people feel comfortable doing that, right? And so just to frame this a little bit, I want to just start with what are opioids, right? So opioids are a broad family of drugs, right? It's everything from oxycodone, Oxycontin, Percocet, hydrocodone. So these are medications that are oftentimes prescribed to treat moderate to severe pain and can safely be prescribed under the care of a medical provider, right? But it also includes the group of illegal drugs that we're seeing. So heroin is one of them, but there's also what is been in the last several years, increase in fake pills, counterfeit pills, what we call street pills, and they're branded oftentimes to be kind of thought of like oxycodone, like some of these prescription pills that are getting prescribed by a medical provider. However, the ones that are being given out but in the drug supply obviously are not regulated. They're not actually the medication that's getting prescribed, and they contain oftentimes a lot of other substances, and it's oftentimes unknown what's in the actual drugs. And so what opioids do, they bind to those receptors, right? They're throughout our whole body, but mainly in our brain. Those are our pain receptors. They bind them, and they reduce pain as a result. But when taken in large amounts or really strong versions of opioids like fentanyl, or when they're mixed with things, so when opioids are mixed with things like alcohol or medications like benzodiazepines, right, that increases the risk for opioids to decrease breathing, which leads to eventually a cessation of breathing, so stopping the breathing, and that is what is leading to the overdose. And if it's not stopped, sometimes it leads to death. And so I just want to highlight and lift up a few things about fentanyl, because that's the one that is driving most of our deaths here in our community. 100 times stronger than morphine. It is widely in the drug supply, so it's mixed in many variety of different drugs, street drugs, heroin, cocaine, a variety of fake pills, and we talked about that. Many may not be, individuals may not be wanting to actually take an opioid or know that they're taking an opioid, right? And so this really makes anyone at risk for an overdose, even if they're just using once. And so I talked a little bit about what happens to the body when an overdose happens. I'm just going to highlight a few things. So an overdose is, that you can have an overdose from a variety of different drugs, right? Including alcohol, right? So it's basically just when the body is just overwhelmed by a substance, any substance, right? When we're talking about an opioid overdose, we're talking about that all of those receptors that we have are kind of bound with that opioid, right, really tightly. And that's when the breathing gets impacted. So we see what's respiratory failure or breathing, our system that allows us to breathe start decreasing, reducing, and eventually stopping. That lack of oxygen in the blood is what's, it's vital, obviously, to all of our organs in our body. And then so our heart and brain start to fail. And then the individual becomes unconscious, and that can eventually lead to death. And so how important and how life-saving naloxone is that naloxone, or also known as Narcan, the brand name, is called an opioid antagonist. So what it does is it restores breathing because it has a stronger bond with those receptors in the brain than the actual opioid. So basically it goes in and it knocks off all of that opioid off the receptors because it's more powerfully attracted to those receptors than the actual opioid. So the goal of Narcan, the goal of naloxone, and what it's doing, it's basically bringing back that breath, restoring that breathing, and ideally reviving somebody from an overdose and potentially a death. A few things I want to highlight about naloxone. It's very safe. There's no potential for misuse. It's not an opioid. It's actually the opposite of an opioid antagonist. There is really no potential for misusing it. It does wear off in about 30 minutes to 90 minutes. It's not a super long acting agent, right? It's in and it's out. It really only works if there's opioids in somebody's system, right? So it has no effect if we're not completely sure like what drugs the person has used or what the situation is. It's not going to have any effect. It'll have zero effect. So let's say you walk by somebody and they're collapsed, they're unconscious, you don't know exactly the situation, right? It's always important to give naloxone a try because you don't know what happened. But if there's no opioids in the system that is causing the overdose, nothing will happen, right? It has no effect if there's no opioids. It's very safe in pregnancy, safe for children. It will only, I just want to underline this, only effective in reducing overdoses that are caused by opioids. I want to highlight one thing, though, that is connected to what we talked about earlier, is that even if the person may not, or the people around them may not be aware that they are using opioids, but what we're seeing is fentanyl is in the larger drug supply. So oftentimes fentanyl, which is an opioid, is mixed with these other drugs. So it's always important to give naloxone a try just in case there are opioids, and that is increasing their risk for what is happening. Just underlying the bottom point of acting fast even before emergency workers arrive. And so that's why we're trying to put these all out in the community as quickly as possible. And then, so we're going to go into a little bit more about what an overdose looks like, how to recognize it, and how to respond. Okay, so I think many of you are likely familiar with some of these signs and symptoms, right? So the person usually is not moving, they can't be woken up, their breathing has slowed down. Sometimes it's not that there's no breathing, but there's these like abnormal breath sounds, right? They're like gurgling and they're choking, they seem like they're struggling to breathe. When we see after the respiratory system has stopped, you'll start seeing all of those color changes, the blue color changes in the skin, lips, and nails, cold, clammy skin. People of different skin tones, it may appear differently. So darker skin tones appear gray, lighter skin tones is when you see this bluish color. We understand that sometimes, it may be hard, right, to recognize that somebody is giving an overdose, experiencing an overdose. But that's okay. When in doubt, we always say, give naloxone a try. So we're going to walk through some easy steps of how to respond to an overdose. We kind of lay them out here and we're going to go one by one. You can go to the next slide, Tara. So the first step is really shake and shout, right? You want to see if the person is just kind of in a deep sleep or just closing their eyes. You want to confirm that they're, indeed not responsive, right? And so the best way is just to shake and shout and yell their name, or just shake them and just yell out that, are you awake? Are you awake? You can also do a sternal rub where you're just rubbing really hard on their chest plate, right? To see if they come to, oftentimes, especially with the opioid overdose, individuals sometimes are intermittently nodding off, right? And so not fully unresponsive. So this will kind of give that, give that alert to them to, come to, right? And so if they're not responding to that, you want to move on to these next steps, right? Calling 911 is very important to get EMS on the way. So we put that as step number 2. And then step number 3 is giving the naloxone. So really it's like, right away you're giving the naloxone right in the beginning to deliver that medication to revive them. And we're going to go through those steps. And I have so there's different types of naloxone in our machines and in our access points. We have the nasal naloxone. I don't know if it's blurry. In these boxes, there's 2 each in each of these boxes. It's basically a nasal spray, right? It's basically a nasal spray, just like other nasal sprays that people get over the counter. Very, very easy to use. Okay, so it's 2 of these are in each box. We have the 3 steps of peel, place, and press. So there's you just peel the package open. I have a little, a fake one here to show you guys. And so this is basically the almost exact size of it and what it looks like. You peel back the package. You place the tip of the nasal spray into one nostril, right? So the biggest thing is you want to hold it like this, right? In between these 2 fingers and the thumb on the plunger, you place the entire nozzle tip into their nostril fully, and you press fully down on that plunger all the way in, and then you pull out of their nostril. So pretty simple there. Can go to the next slide. And then then it's the follow-up steps. You want to try to keep them awake and breathing. If in 2 to 3 minutes they do not respond, you can give another dose, and that's why each box has 2 Narcans, because oftentimes people need more than 1 dose. The important thing is try to give it in the other nostril that you didn't use, and you can give naloxone every 2 to 3 minutes as needed. If they have not woken up. And then, the big thing is staying with them until emergency first responders can come help take care of the individual. The next slide, did we miss one? I feel like we may have missed the rescue breathing one. Can you go back? Sorry. It might have been out of order. So the important thing is to give naloxone and give naloxone right away. We know that an opioid overdose involves the breathing that has stopped, right? And so if you feel comfortable in between the doses of the Narcan, you can give rescue breath. And, I know we had our other individual who's talked a lot about CPR right before us, which was great. This is if you feel comfortable, right? If you don't feel comfortable, it's always good if you just have Narcan to give Narcan alone, right? Because that works in and of itself. If you do feel comfortable, you can give rescue breaths about 1 every 5 seconds in between those doses of Narcan until the breathing comes to. So aftercare, right? So one thing that I want to lift up is that if you have to leave, even if it's for a brief amount of time to call 911 or whatever reason, you want to put them in what we call recovery position. So that's putting them on the side. There's a little picture up there on the top corner with their kind of one knee is up and their head is under their on top of their arm. This helps prevent choking. So it keeps the airway open. So we always say roll them on their side and put them in recovery positions. If they start breathing regularly, you also want to roll them on their side if they're not completely awake and moving. Once they wake up and they get, revived after this overdose, there could be some confusion. There could be some, irritation. Some individuals may have some what we call withdrawal symptoms because remember, the Narcan is knocking the opioids off of all of those receptors, right? And that is what's bringing their breath back. And so sometimes this may lead in certain individuals, especially in individuals who may use opioids more regularly, withdrawal symptoms from the opioids. And so it's important just to provide, this is usually not a serious, it's mainly discomfort and being kind of agitated. So you just want to provide the support until first responders can arrive and orient them to what happened. Again, naloxone does wear off after 30 to 90 minutes. So it's important, one, to stay with them, encourage them to go with first responders, and then always have more Narcan around just in case an overdose symptoms may return after that period that naloxone. And some of the other things we kind of mentioned, you can be repeated as needed, as many times as is needed. We really want to encourage folks to go, get that first responder care, go to the emergency room, right? Because that's where they can get linked to more further resources. So we try to encourage that as much as possible, even though we know many individuals choose not to go with first responders. We have listed some resources here for crisis response, our crisis response partners, and our post-overdose response partners in Wayne County, and some links there. We wanted to highlight the Michigan's Good Samaritan Law, which protects individuals who are responding to an emergency, especially naloxone and an overdose emergency, and protects them in that situation. I will stop there, and we can take any questions, or Tara, please chime in if there's a piece that I missed. Oh yeah, why don't you talk about that?
Yeah, I'm mindful that we're probably right at 1 o'clock. So I just wanted to throw this up for awareness purposes. We'll make sure that you have it. The state runs the naloxone portal. So any organizations, individuals interested in finding out more resources or requesting naloxone can do so through the portal. And then recently through DHHS, they created the Substance Use Disorder Services Programs dashboard. Essentially, it's a map that has different providers located. You can look at it by region or by county. So just a couple solid resources, at least at the state level, for accessing both naloxone and treatment recovery supports. Beyond that, I think both Dr. Sheth and I are always available. We'll make sure our contact information is provided, but we welcome any opportunities to continue discussions and really appreciate you all allowing an opportunity for us to speak on this and kind of elevating the issue and helping educate and support.
Yeah, and on the website too, there is handouts and fact sheets and videos, really short videos, like 30, 60-second videos, walking through exactly the steps that we talked about too. So some follow-up there as well.
Okay, awesome. Thank you so much, Dr. Sheth and Mrs. King. Before we go into the questions, Madam Clerk, we had a oversight. We had a logo for the Wayne County's Women's Commission logo for the resource fair. We need to take a quick vote on that through the clerk, and then we can proceed with questions. And yeah, that's pretty much it. So Madam Clerk, could you come back on for a brief moment to do a vote on the logo that Madam Vice Chair Cynthia Douglas presented right before the presentation?
Yes, I'm here.
Okay.
I'll make a motion to approve the logo for the Wayne County Women's Commission. Member Daub.
Seconded.
Who seconded?
Yvonne. Cash.
Gotcha.
Mm-hmm.
All in favor?
Aye.
Aye.
Okay. Any nays or abstentions?
Motion carried.
Thank you, clerk. Okay, thank you, everyone. If everyone could just hold for a moment, if you have any questions, and of course, we would like to invite the both of you to our wonderful Wayne County Women's Resource Fair on April 7th with this wonderful Narcan information, but we'll get that through Member Daub very soon, or Commissioner Daub very soon. So if anyone has any questions through the clerk or through Commissioner Daub, please at this time.
I just want to wrap up, I guess, start our question section. I don't know how many people can stay on just a couple of more minutes, but I really want to thank Dr. Sheth and Tara for this presentation. And I'm hoping that this can kind of start our advocacy of promoting the Wayne stations to women in the county, and just getting the word out, making sure that women know what Narcan is and how to use it and know where to get it. And and like Dr. Schatz said, it's not really a training. We don't need to be trained. We don't need a certificate to have it and know how to use it and tell other people about it. So it's really kind of simple. Anyone else have any questions? Well, please check out the website and find out where the nearest Wayne station is to you, and go and check out the machines. They're pretty cool. I went and found mine here in Canton, and I press the button. It's just like getting a Coke or a snack in a vending machine, except you don't have to put any money in, and you just get a little box of Narcan, and you can have it at your home just in case.
I was going to ask, this is Chair Crawford, if anyone has any questions further, or even for Dr. Schatz or Ms. King in regards to Narcan, even after, like an afterthought, I'm going to ask that you can reach out to Commissioner Dobb, if it's okay. Are you willing? Okay, thank you.
Yeah, for
So
sure.
that-
I can be the middle person, or I see Tara put her email in the chat too. So feel free to reach out to either one of us.
Okay, yes, that way, again, this is a great training. So thank you. So if there's any more questions at this time in regards to Narcan training, this wonderful Narcan training.
We appreciate the opportunity to be here, and we're available whenever. So thank you so much.
Thank you all.
All right, awesome. We'll be reaching out because for the Wayne County Women's Resource Fair at Schoolcraft College, Member Gator has requested, and we're going to go through work with Commissioner Dobb to see if we can get you there. So it'll be great. Thank you again, Madam Clerk.
Moving to item G, such other matters as may be properly submitted before the commission.
I have not received anything, Vice Chair Douglas.
I just have a couple things. Wayne County Commission is doing a Black History presentation on Thursday. So if you want to tune in or come down to take to see what's going on, Commissioner Kinlock is doing the presentation this year. And also Commissioner Bell's prom dress event is April 5th. She also needs volunteers. Usually it's on April 4th. If you need some more information about volunteering, let me know. And we'll get that information to you. But it's usually a great event. If you have prom dresses that you are not using anymore, or wedding dresses or bridesmaids dresses, whatever, please make a donation. There's a lot of young ladies who do not have access and cannot afford prom dresses. And so this is a great opportunity for them to get a free dress and accessories and shoes for their prom. So that's all I have, Madam Chair. Thank you.
Thank you, Vice Chair Douglas. We both volunteer. We volunteered for several years assisting with the prom dress giveaway. And I can honestly say there's a request for plus size dresses as well. So if you have anyone or know anyone, we're usually short in that area, and there is a need. So beautiful dresses, yes, please, especially plus size for our amazing young ladies in the community. Madam Clerk.
Each public comments.
All right. At this time, again, do we have any public comments? All right. A request of any public comments at this time?
There's a hand.
Oh, all right. Hand is. recognized.
Ms.
Thank
Dukes.
you.
Oh, Ms. Dukes, there you go. I say, okay, there you are. Yes,
I was
Ms.
gonna
Dukes.
wait to be properly noted and recognized. I want to be in
Find you.
order. And from both AHA but public announcement and comment standpoint, wanted to share with this body a piece that I also shared with the commission, and that is that we have a move afoot for a RFP to be sent out for a cigar lounge, restaurant, bar at the DTW McNamara terminal. And let me look through the pictures. Most folks are in shock and awe when I look at their faces when I make this announcement, and they're like, well, we haven't heard anything about this. And that's the absolute distinct plan, is to try and get this to go under the radar. But Wayne County Airport Authority does have a meeting this Wednesday, the 19th at 2 p.m. in their administrative offices or their boardroom. And AHA obviously is adamantly opposed, along with Wayne, Detroit, Oakland, Tobacco Free Coalition, the National Non-Smokers' Rights Association, lung cancer, everyone that wants folks to live a healthy life. This is for a space of 3,700 square feet on the first floor as you come out of TSA down off the escalators, where the Johnson and Murphy location used to be. For women, we are going to probably be the ones scoping out and looking for someplace to eat right before we jump on a flight, or if we have a layover. This is not a closed-in area. This would be an open area, open front area. So it would affect all travelers. So again, wanted to make folks aware that, because we know how to advocate. On February 19th, 2 p.m., the Wayne County Airport Authority will be meeting, and we would love to have folks come out and express their opposition to any form of an inclusion of a cigar bar, lounge, or restaurant in the McNamara terminal. Thank you.
All right, and thank you. And Ms. Dukes, please forgive me because you were still on and you're invited as well to the Wayne County Women's Resource Fair. So we want to
Your
make
vice chair
sure.
had you all covered in the note over in the chat. She was like, and you did see April 4th, 7th, right? I was like, I got it noted. I'm going to talk to our community impact folks and see who can get it out of their schedule and reach out to you all.
Awesome. Thank you. And work with Vice Chair Douglas and get you right on taking care of the right way.
Yeah.
Okay. Thank you very much. Thank you for your comment. All right. Last call. Are there any public comments at this time? All right. Madam Clerk.
Adjournment.
All right. Thank you again, wonderful women of the Wayne County Women's Commission. Please feel free to reach out to Vice Chair Douglas and I. It's so great to see many of you healthy, happy, and well. And I'm going to request adjournment at this time at 1:11. Uh-oh. And happy Valentine's Day, Galentine's Day,
Second.
all of that. Motion?
I made a motion to adjourn.
Second, gotta go.
Gotta go.
Okay. Take care. Thank you.
Thank you, everyone.
Bye.
Bye.